I'm Kate Jordan, the developer of the Bodywork for the Childbearing Year Advanced Certification Training in pregnancy, labor support, and postpartum bodywork techniques. We're continuing our description and demonstration of the use of Bindiga Vapes massage or connective tissue massage for the postpartum pregnant woman. The application of Bindiga Vapes massage, the very specific application of fingertip pressure to the skin and superficial fascia of the body, is not appropriate in postpartum women who've just experienced a C-section. So Bindiga Vapes massage is appropriate for women who've had a normal vaginal birth and not one with any complications. It's also not appropriate for someone who has recent severe stretch marks or for anyone who has very, very thin skin. So Bindiga Vapes applications on the abdomen in your postpartum clients has three primary benefits. The first is that it prevents the formation of adhesions at the level of the skin superficial fascia, and also adhesions at deeper levels of viscera. It also increases vascular perfusion in the tissues and increases the rate of intracellular and intercellular disbursement of all the fluids that accumulate in the body during pregnancy, particularly in the area of the abdomen. Connective tissue massage, and this is what most pregnant postpartum women are especially interested in, increases skin tone and increases skin elasticity. So it helps women get their pre-pregnancy abdomens back. And connective tissue massage is applied with the fingertips of weak fingers. So usually the third and fourth fingers are the fingertips that are used. I'm going to draw the locations of the application of connective tissue massage on Dana, who's recently postpartum, and then I'm going to apply that with the use of the specific Bindiga Vapes technique. So Bindiga Vapes is applied with a fingertip pressure only at the level of the skin and the superficial fascia. It's applied for a total of 3 repetitions, starting at the pelvis and then moving superiorly. Notice that as I apply the application of the connective tissue technique with the tip of just one finger, I'm using the other hand to make the skin of Dana's abdomen taut. That's stroke number 1, a dragging and pulling stroke from the anterior superior iliac spine down to the inguinal ligament. Stroke 2 is a series of tiny half-inch dragging and pulling strokes at right angles to the first stroke. And this is also applied bilaterally. And I want to make sure that Dana is experiencing this technique as it should be experienced. She should be feeling ripping, tearing, cutting, slicing, scratching, burning. Any of those words, but no pain. So Dana, what would you report that this feels like?
Ripping, burning, tearing, yes.
Great. So this is stroke 2. Stroke 3 is a series of 1-inch long dragging and pulling strokes at the lateral border of the rectus abdominis, starting at the pubic bone and moving up to the inferior border of the rib cage. Notice that this technique is applied very, very rapidly. If, as I was applying this technique, Dana reported to me that she was experiencing any pain, I would slow down or I would make my stroke shorter. Now, Dana, experiencing any pain or discomfort?
No.
And Dana, are you noticing any difference in this stroke as I move above your umbilicus, above your belly button?
I feel it more with the belly button.
Okay. And so if Dana feels this above her belly button, that tells us that she probably has some dysfunction in the thoracic area, and her skin is reflecting that. That's stroke number 3. Stroke number 4 is a series of dragging and pulling strokes that are initiated at the xiphoid process and continue on the inferior border of the rib cage, always from medial to lateral. And this has a tiny little hook at the end, and it's this particular technique that is used in myofascial release, called the J stroke, and this came from Bindiga Vapes or connective tissue massage. Now this is useful for indigestion, for the constipation that is commonly an accompaniment in women in their first month postpartum, and for the vague intestinal disorders that may accompany the postpartum period. Once again, not appropriate in someone who has just had a C-section. The very last stroke is a circular spiraling motion that covers the entire abdomen. And this is particularly useful in moving fluids from the interstitial spaces into general circulation. The average woman has 4 pounds of extra water or fluid in the abdominal tissues in the immediate postpartum period, so this helps to move that into general circulation. Notice that I'm using just one hand to do this and one fingertip. And also that this technique is very superficial. I am no deeper than the superficial fascia. Dana, how deep does this feel to you? Does this feel deeper than,
Yeah.
does this feel deeper than 1/8 of an inch?
Probably,
Yeah.
pretty deep.
Feels pretty deep, but in truth, I'm just on the surface of your skin. But that's what it should feel like. Notice that there's a significant histamine response. This is the normal response to connective tissue massage. Once I have done the connective tissue massage on Dana's abdomen, I can move to other parts of her body to continue the application of connective tissue massage. I want to thank Oakworks for providing me the opportunity to share this information with you. Thanks.